Force analysis is an additional tool used during the quality improvement process. This analysis presents the positive and negatives of a situation so they are easily comparable. It also considers all aspects of making the desired change and encourages the honest reflection on the underlying roots of a problem and its solution. This requires the brainstorming of all the possible forces inside and outside of the organization that could work for or against the solution. The length of each arrow in the diagram depicted is proportional to the strength of the force it represents. The key to a force field analysis is to discuss how to increase the forces for the change and how to reduce those against it. The driving force that supports this change focus exclusively on three main points: to reduce IV push medication errors and medication waste while increasing patient safety. The restraining forces against this change include additional steps in the already saturated medication administration process and documentation of patient care, strain on time management with medication administration, and an increase in wait times in between each patient. The driving force supporting the reduction in IV push medication error is far stronger than the restraining force of the additional steps in medication administration and documentation. IV push medication errors are not reversible in most cases and can increase mortality in patients. The arrow for this driving force is therefore reflected in a longer length. The driving force for reducing medication waste is moderate in strength, as it reduces expenses and allows for pharmacy to provide more efficient and time-effective response to other medication requests. However, the restraining force focuses on the strain on time management for the nurses. The new policy requires the nurses to only pull for one patient and administer medication within 30 minutes of the PICS's time. This could cause a strain in the time management, as assessments must be performed prior to pulling medication, and the donning and doffing of PPE increases the workload. In this analysis, the restraining force is depicted as longer by a moderate amount. Lastly, and most importantly, the strongest driving force for this change focuses on patient safety. As previously mentioned, IV push medications, once administered in error, increase mortality in patients as it is given directly into the bloodstream. However, the restraining force against patient safety emphasizes the increase in wait times in between patients due to the increase in workload and proper sanitation for proper infection control. In any case, patient safety has a higher priority over any listed restraining force and is depicted having the longest arrow that drives for change. By using force field analysis in quality improvement, we help reflect and counter the opposing forces and increase the favorable forces to help induce change by reinforcing positives and reducing or eliminating the negatives. In this study, the favorable force of patient safety helps emphasize the importance of this change and helps reduce the existing negative restraining forces.